Good evening, everyone. We are so happy you joined us this evening. November is designated as Diabetes Awareness Month. In fact, Saturday, the 14th, was World Diabetes Day. So we want to take the next 4 days and spotlight this disease. Before we get started, though, we want everyone to share this video, tag your friends, start watch parties. We want as many people as possible to get this valuable information. Also, the hashtags we want to use this evening and throughout the event when you post about our challenge is or are Team Destiny, that's the first one, and diabetes awareness. So like and share this live video to as many people as you can think of. We've got some amazing giveaways this evening, but you do have to register and you do have to participate. By participate, we mean you've got to share, you've got to participate, you've got to put comments in. We want you to be engaged. Tonight, some lucky person will win a $50 Amazon gift card. But to get the gift card, remember you've got to register and you've got to participate. So just for showing up here tonight, just for registering and just for participating, someone is going to walk away with that Amazon gift card. So are you ready to get started? If you're ready to get started, I want you to put ready in the comments. Put ready in the comments if you are ready to get started. So the current CDC statistics state that there are about 34 million people in the United States with diabetes. Of that 34 million, about 7 million actually do not know that they have diabetes. That's pretty scary. Then there's another 88 million who have prediabetes. So we want to share this information with you this evening and throughout the next several days because number one, we want those people who have prediabetes, we want to interrupt their progression to diabetes. Number two, we want those who have diabetes to be empowered so that they can actually thrive while having their diabetes. And we want those 7 million individuals who have diabetes but don't know it to become aware of their condition. We want to make sure that they are able to recognize that they become diagnosed with diabetes so they can begin the treatment that's necessary. You know, many people with diabetes suffer in silence because there's a certain amount of shame that people carry when they have diabetes, particularly when they have type 2 diabetes. So we want to break down the stigma of diabetes so people can thrive with diabetes. So we are excited to kick off this challenge tonight. We've got a great lineup of speakers throughout the week. We want you to show up every night. We want you to be engaged. We want you to learn a lot. We want you to share the information that you learn, even if you can't use it yourself. We want you to share it with family and friends. So tonight we have Dr. Loida Brooms-Williamson, who is going to talk to us about the stress of living with a chronic disease. Now, Loida has quite an impressive bio. She currently serves as the chair of psychiatry at Meharry Medical College. Now, that's impressive to you guys, I know. I'm very proud of Loida because I've known Loida for a long time. Loida and I are family, and she is someone that I've always looked up to, and I've kind of followed in her footsteps to a certain degree in pursuing a career in medicine. So I want to welcome Loida this evening, and I want to introduce her to our viewing audience. Dr. Loida Brooms Williamson, we're grateful, we're honored that you're here, and we're looking forward to what you have to share with us tonight. Looks like we're having some difficulties connecting with Loida. While we're working through that, we just want to continue to share with you some of the things that are coming up this week. So tomorrow evening, we will have another guest speaker, Dr. Desiree McGann, who will be sharing with us about diabetic foot care. On Saturday evening, our guest will be a registered dietitian, Ms. Winifred Smith, who will share with us the importance of proper nutrition as you care for your diabetes. And then as we culminate our challenge on Sunday evening, we will have endocrinologist Dr. Dwayne Wood, who will share with us, and he will give us a broad overview of the disease called diabetes that is really an epidemic here in our country. He will talk about epidemiology. He'll talk about the statistics related to diabetes. He'll talk about the diagnosis of diabetes. When do you need to be evaluated for diabetes? He'll talk about some of the presenting symptoms. He will distinguish for you between the different types of diabetes. There's type 1 and there's type 2. Most people are probably type 2 diabetics because that's just more prevalent. I see Dr. Williamson is back with us.
I'm back. Thank you. Little technical problems, but I'm so glad to be here. Thank you, Dr. Charmaine Wood. So let's get started. So one of the things that we realize is that living with diabetes can be stressful. We're dealing with lots of stress with maintaining schedules at work and home and relationship. And then on top of that, we're dealing with the personal stress of diabetes. And for some people, this is easily managed, but for other people, this can be overwhelming. When you're under physical stress, your blood glucose levels can increase, just like when you're sick or injured. But there you can also experience increases in your blood glucose when you experience mental stress. And that can happen with both, particularly with type 2 diabetes. With type 1 diabetes, with that stress that's mental or emotional, you can have an increase in your blood glucose or a decrease in your blood glucose. So how do you know if you're experiencing stress? Sometimes we're just going through the motions and routines of our lives and we don't even realize what's going on. There are three aspects I want to focus on: physical stress, emotional stress, and social stress. So you may be experiencing physical stress if you have body symptoms such as headaches, muscle pains, sleep problems, just difficulty sleeping with insomnia, or just feeling ill and tired, fatigue. You might be experiencing emotional stress if you're just not motivated to do the things that you usually enjoy doing. If you're irritable, snappy, short-tempered as you're interacting with people, or if you're feeling sad, numb, or even really down and depressed. You can also be experiencing emotional stress if you're anxious. What about social stress? If you're experiencing isolation from others, don't really want to be around others, or on the other hand, when you're interacting with others, if you're irritable, angry, and short-tempered, many times people are coping with these stressors by doing things that are not helpful to their body, such as smoking or using other substances like alcohol or marijuana. So What can you do when you're experiencing these stressors? Develop a plan for change. And I'm mentioning 4 steps. Admit that you're having a problem, analyze the problem, act on the problem, and then assess what you're doing. So if you're experiencing stress, admit it. Stop the madness. Stop running around trying to take care of everybody and everything and then being ineffective in that process. Stop and next analyze. Analyze what you're doing. So with diabetes, 2 things you can do is keep a log of when you experiencing high levels of stress, and at the same time keep a log day by day of when your blood glucose changes, increasing or decreasing dramatically. And then put the 2 together. Is there a correlation? If you do notice that there are times when you are stressed and those blood sugars go up or down, then you need to make a plan to make some changes to be able to manage with that stress. And then after you make those changes, assess. Assess the changes that you've done to see if you are experiencing improvements. If you are, then you continue with the plan that you made. And if not, you may need to make some adjustments. So what are some ways that you can decrease the stress in those areas? Physical, emotional, and social. Well, physical, of course, what you're going to do is talk with your physician. See what recommendations your physician has to make changes in your health plan. Of course, I'm sure they're speaking with you about your eating plan. We don't want to use diet because we're talking about making long-term changes that are sustainable. It is always a good plan to keep drinking water. Water can help you feel less stressed physically because many of us don't drink enough water in the first place. Many of times when we're experiencing fatigue or even hunger, what we think is hunger is actually dehydration. So drink plenty of water. There's another plan to keep physically active and try and incorporate that in a regular way. 3 times a day for 10 minutes, take the stairs at work, walk up and down your driveway, or even walk around multiple times in your house. Get physically active. And then at the end of the day, work to spend 7 hours of sleep at night. Then you get that restorative sleep so that you can detoxify the stress that you experience during the day. What about emotional stress? How to decrease that? Well, try removing yourself from negativity. Sometimes it might be temporary, and sometimes it needs to be permanent. There may be some people you need to spend less time with. There may be some things you need to spend less time doing. For example, watching the news or watching media before you go to bed when it's full of negativity doesn't really help your mind rest at night. Do some visualization techniques. As much as you possibly can, take a mental vacation, go to the beach or go to the mountains and relax. Enjoy and picture yourself right there on the beach. Have a positive mindset. Instead of thinking of your life being all negative and your glass being half empty, think of it as being half full and count your blessings. What about social stress? Change your routines. Prioritize the things that are important and start cutting out some things that you're doing to please others that really aren't important in the long run. Learn how to say no. Saying no appropriately to people who are trying to impose upon you can decrease your stress. And then plan a 15-minute rule. Plan to do things 15 minutes early. Plan to wake up 15 minutes early so you can think about your day and plan. Try to get to your appointments 15 minutes early so you're not rushed at the end of the day. Remember, as you are going through and living with diabetes, you are not alone. Talk with your physician. Share with a friend who may just want to listen and provide some support. There are support groups for individuals who are living with diabetes. So look for one that might be able to be helpful for you. And then, of course, if you're experiencing extreme stress, talk with your doctor and see if it may be helpful for you to meet with a therapist or a counselor. So, in summary, even though diabetes and living with diabetes can be stressful, what I want you to remember is that it's important for you to recognize your stressors, develop a plan, and learn how to manage your stress better. What are the 4 steps? Admit that you are experiencing stress, analyze your stress and analyze your day, act by making a plan, putting it in place, and then assess. See how well your plan is going. And then, of course, ask people like your physician, your friends, or a counselor to help you as you live with diabetes. I am so thankful for your attention. Now we have a few minutes for questions.
While we're waiting for some questions, I just want to thank Dr. Williamson for the informative presentation. I took some notes, and if I can share with everyone some of my notes, some of the highlights. So I understand now that to manage my stress, I need to admit that I have stress. I need to analyze. I need to make a plan and act. And I need to assess whether or not those actions are having the desired results. Did I get that?
You've got it right, Dr. Wood.
Okay, good. And then you talked about the different areas of our lives that may be impacted or affected by stress. You talked about the physical and you suggested ways to cope with that. Of course, seeing your physician and um, uh, getting that physician's input, but you also talked about some of the things that we can do. And I think many of us know that good nutrition is important. We know that exercise is important and that we have to work that into our routine. I don't know that many of us recognize the part that getting restorative sleep, that adequate rest, at least 7 hours at night, I don't know that many of us recognize how critical that is just for general health and well-being. And you mentioned emotional stress. Now, what I liked you said was to remove the negativity. And you recognize that it's not always possible to completely take yourself out of a negative situation, but maybe just doing it on a temporary basis. Maybe it's just, okay, I just need 5 minutes, just 5 minutes, and then I'll come back when my head is in a better space and I can deal with whatever that is. So that was, I think, an important one for us to recognize. Now, someone has a question and they say, I have a hard time saying no. This was one that resonated with me as well. How would you suggest getting better at that? What suggestions do you have to help us say no? I've heard someone say no is a complete sentence. And sometimes when we say no, we feel like we have to explain why. And we spend a lot of time making excuses for why, or maybe not excuses, but we spend a lot of time trying to explain away our no's. What are some suggestions or maybe some skills you would have to help us get better at that?
Sure, that is an excellent question. And I think the first thing is to prepare ahead of time. All right. And that means to get in the mindset that you are really working to take better care of yourself. And in order to take care of other people and help other people, you can't wear yourself down. A lot of times, what we do is use up all our resources until we're dry and our cup is empty. We have to keep our own emotional and physical cup full. So, in order to do that, you recognize I can't keep putting into other people what I don't have myself. And in order for me to have that for myself, I have to take care of myself. So, understand what time frame you need for yourself, understand what's important for your family, and understand what's important for your work. When you look at the time that it takes to do those things, and other people ask, can you do this? Can you help me with this? You can let them know, I'd really like to. So maybe it's about reframing the no. I'd really like to do that. However, right now, I'm not able to work that into my schedule as I used to because I'm taking care of myself. So I won't say I'll never do it, but I just can't do that right now. So maybe phrasing it in a way that you're feeling like you're shutting them off, but that you let them know your health is important and you really have to take care of yourself first, which is not being selfish. But after you take care of yourself, then you can help other people, including your friend or even your family who may be asking that of you.
Okay, well, that was a great response. That definitely helped me, and I'm hoping it helps our viewing audience. Just recognizing that you have to set appropriate limits in order to take care of your own well-being, and that indeed is not selfish.
That's right.
Okay, awesome, awesome. So someone says, I think I may need to see a counselor, but I'm embarrassed to admit I need help.
Wow, that's such a great comment, and I'm glad you asked that. So, we have a hard time understanding that the brain takes care of the rest of our body. So, if our brain and our emotions aren't functioning well, it's going to be really difficult to do all the other things that we need to do. Now, I think most people realize the importance of prevention with your dental care. You don't wait till all your teeth are falling out before you go to see the dentist, but in order to keep your teeth healthy, you go to the dentist on a regular basis so that problems that come up with your teeth can be addressed early. We need to think of our mental health the same way. So, as we recognize that we're having difficulty, it's actually a good thing to go talk with somebody and ask for help while the problems are minimal before they expand and snowball and you're really struggling with being able to do things on a regular basis. So think of talking with a counselor as being preventative or early intervention to prevent larger and more serious problems from happening. So I think if we change our perspective and our mindset, we'll be able to do much better.
Okay, great, great, great. I liked how you approached that. I think that's important to think of our mental health and to take care of it in take the approach of preventing any serious issues rather than waiting until things have really spiraled out of control and then we're in crisis mode. So I appreciate that perspective.
I'll just add
Okay.
one other thing is that it's a strength to ask for help versus needing help and not asking. So just remember that.
Yes, yes, yes. It's a strength and not a weakness.
That's
So,
right.
great point. Great point. Well, those were some great questions. You took a lot of time responding, and we appreciate that. I thought the presentation was wonderful. I got a lot out of it, and I'm curious as to what our viewing audience got out of it. Audience, if you would just put in the comments, what were some of your takeaways? We've heard someone ask about saying no. Um, I thought I liked when you said that you are not alone. I really appreciated that, because sometimes when we're going through a challenging time, we tend to isolate. We tend to feel that no one understands what we're going through. But just know that knowing that you're not alone really is helpful to navigate whatever circumstance you find yourself in. And you mentioned that there are support groups for diabetes, and that it's important for those struggling with diabetes to find a support group and become active, find some way of serving others within that community, and that's going to help as well. So, Dr. Williamson, once again, we appreciate the time that that you took to share with us this information. I know you're on a tight schedule. We were quite fortunate to have you come and speak with us. So we just want to say thank you. And I'm sure there's probably more you could have said on this topic, and maybe we'll have you back at another time to share with us some more. I hope it's okay if we ask you to come back in the future.
Sounds good. Thank you for having me. I enjoyed being here with you. And
Okay.
best wishes with your challenge this week.
Thank you. Thank you. Thank you. Okay, so guys, go ahead and put your takeaways in the comments. We want to know what you got out of the presentation, and if you may get something out of it that someone else didn't get, and that may bring an awareness to them as well. So go ahead and put what you got out of the presentation. Put that in the comments. And what we'd like for you to think about is, what are some of the strategies that Dr. Williamson mentioned that you can implement? So, I think one of the ones I mentioned that a lot of people don't recognize the importance of this is commit to getting proper rest. So I would like for you all to commit to getting at least 7 hours of sleep each night. If you are going to commit to that, put that in the comments as well. Just put sleep, or sleep 7 hours. Go ahead and put that in the comments. The other thing I think is important, another important takeaway is say no. If you're gonna say no, put that in the comments. I'm gonna learn to say no. Put that in the comments. I'm gonna learn to say no. And then she broke down activity in a way that's very doable. She suggested just 10 minutes 3 times a day. That gets you your 30 minutes of activity. And activity is one of the things that really does help to reduce our stress. Sometimes we're pressed for time. We don't have a full 30 minutes to commit at one time. So we can break it up as long as we're able to get in the 30 minutes for that day. So so I mentioned earlier that tonight we will be giving away a $50 Amazon gift card just for showing up, just for registering, just for sharing and participating in our discussion. But let me tell you, in a few minutes, I'll tell you who won, but let me tell you what's coming up tomorrow night. Tomorrow night will be a nutritional supplement that many people with diabetes are using to help lower their blood glucose levels naturally. This product contains several ingredients with which you may be familiar, but this product, Captivita Plus Glucose Support, has a proprietary blend of berberine, bitter melon, alpha lipoic acid, Garcinia cambogia, cinnamon, ginseng, curcumin, bay leaf, aloe, and chromium. So look at what one individual had to say about his experience with taking Captivita to help lower his blood glucose levels. So he says, my doctor told me my A1C was elevated to the point I needed medicine to control it. I listened and then prayed. I said to myself, I did not come to this country to be on medicines. I changed my diet as much as I could and bought a supplement called Captivita. What a game changer. When I returned to my doctor, she was surprised and asked if I was taking the medication she prescribed. I said no. I'm not sure she believed that what I was doing was working, but numbers do not lie. My A1C went from 8.5 to 6.2 in 4 months. Thank you, Captivita. And that is from Philip O. So remember, to be entered for all of our prizes, you do need to register and invite guests and share our live feeds. So tonight's winner, once again, just for showing up, registering, and inviting guests, is Carolyn A. I'm not going to say your full name, Carolyn. Carolyn A. So Carolyn, you are the winner of the $50 Amazon gift card. Congratulations, Carolyn. Wow. So what an awesome night we've had. This was a great way to kick off our challenge. I want to thank everyone for coming. I believe the information that Dr. Williamson shared was valuable, very informative. I hope you find it useful. And more than that, I hope you share it with your family and friends. If you learned a lot tonight, then be sure to come out tomorrow evening and hear about diabetic foot care. In our country, there are lots of individuals who have suffered complications from diabetes, and it's affecting their limbs. Many of them have had to have toes or even feet or legs amputated because of diabetes. So Dr. Desiree McGann is going to share with us ways to prevent that complication from diabetes. So we want to wish you a good evening, and we'll see you back tomorrow evening at 8 p.m. Eastern Time, 7 p.m. Central, where we will pick up with our Diabetes Awareness Challenge by discussing diabetic foot care with Dr. Desiree McGann. I wish you all a good evening, good night, and take care.